Hey guys, it's me, Greta. This is going to be a what you should research on cosmetic surgery. So I'm going to do this video because there's been a lot of you guys expressing your concerns. You guys want to travel out of the country, internationally, Mexico, Colombia, Nicaragua. There's a lot of you that I've been getting inboxes for on what's the must know, what should we ask, what are the proper questions, what should we keep an eye out, and this is going to be that video. So I think it's important for me to do this video because a lot of people have the misconception that traveling internationally is something scary or something that is going to go wrong or it's a risk. So this is my take and on that whole situation, okay? So just how I made my previous video about what's a 411 on what the doctor and a textbook can't tell you about a weight loss surgery, about weight loss surgery, like someone that's living it. This is going to be what's a 411 on someone that has traveled internationally and what to look out for, okay? So number one thing is do your research. You're going to hear me throughout this video talk about research, research, research. Number one, not every doctor is a good doctor, regardless if you are having surgery in the US, in China, in Mexico, in Nicaragua, in Colombia. Not every doctor is a good doctor, regardless across the board where you go, okay? What state you go, what country you go to, not every doctor is a good doctor. So do your research on that doctor. Get to know, look him up on Google, see what he's into, what his reputation is. Listen to your gut feeling. If you are talking to a doctor and you don't feel 100% comfortable with him, that is not the doctor for you, okay? Ask questions. Ask questions about the procedure, the steps, especially if you are traveling out of your area, regardless of where you're going. Ask about the recovery stage. For those of you that get tummy tucks, for those of you that are getting breast augmentations, breast lift, some of you have to have drains, okay? Ask about the removal. If you are traveling out of state to have surgery, ask about what is a mandatory time frame for you to be there. Ask about the removal of the drains. How does that work? What is a procedure? Do not let a doctor send you home with drains, okay? My doctor, Dr. Siu in Nicaragua, he would not let me, let alone travel an 8-hour flight, even if it was an hour flight with drains. Two, he wanted to make sure he took out the drains. If I needed stitches where those drains were, he was going to put those in. If I needed stitches removed, I needed a certain amount of follow-up visits before I traveled back home. So he wanted to make sure when I traveled back home, I was in complete recovery stage, not in fresh out of surgery, still needed some, things to be done and I could do them on my own. No, if you're talking to a doctor that you have to travel to and he's going to send you home and you still have to, do certain things when you go home, that's not the doctor for you. And you can weed those doctors out by the way they answer these questions. Do your research. Do not let a doctor send you home and you still have to, finish his work when you go home. That is not a good doctor. Okay. Another tip, if you're getting implants, if you are getting a breast lift with implants put in, if you are getting a breast augmentation, ask about the brand that the doctor is putting in. He could tell you the stars, the moon, they're the best implants in the world. Do ask what brand they are. Do your research. Look at the reviews on those implants. This is something that you're going to have in your body for the next couple years. So you want to know what you're putting in your body. Just how every doctor is not a good doctor, every implant's not a good implant. Do your research. Are they silicone? Are they saline? What are the pros and cons of having saline and silicone? Ask those questions. Most important, do your research on the doctor. Like I just said, do not assume that every doctor is a good doctor, regardless if it's in the US or internationally. Don't get it twisted, okay? There are just as many malpractices here in the US as there is internationally, but it's up to you to weed those doctors out. Do not take the doctor's word, oh, I'm this excellent doctor, this and that. Okay, well, show me the facts. Show me your client. Show me reviews. Like, I want to know. Ask about the facilities of where you will be having your procedure, especially if you are traveling. Ask the name of the hospital. Please make sure it's in a hospital, okay? Ask, the name of the hospital. Go to the hospital website. Find out the reviews. Look at the reviews. Look at the pictures of the facilities. When you get there, if it does not match with the research you did or what the doctor told you, red flag, do not have surgery. If things don't match from day one, when you get there, do not have surgery. Listen to your gut feeling, you guys. At the end of the day, we are responsible for what we allow to happen. If the day I laid on that bed, if I wasn't 100%, my ass wasn't going under. Period. Before day of surgery, make sure you touch bases with your doctor. You go over the procedures that you guys have been talking about and make sure you are on the same page. Another important thing, do not let a doctor put you under without him writing on your body on where he will nip and tuck, making sure he measures everything's going to be symmetrical. You do not want to come out of surgery with one boobie on your shoulder and one boobie on your stomach because this doctor didn't write on you. Those are important steps that he has to do. I have seen, including, people that I know, that they go into surgery without the doctor even writing on them, and they come out and they're not happy with the result. That is something that a doctor has to do. He has to write on your body to see where he will be nipping and tucking. My doctor had me for an hour and 23 minutes. The only thing Dr. Sue didn't have me do was stand on my head, but that man wrote all over my body. He had me sit on my side. He had me lay down to see how my skin falled. He had me stand up straight. He had me bend down. He had me do everything to make sure everything was symmetrical, no matter how I laid, no matter which way I stood. Everything matched. So important for you guys to see that and for you guys to ask about that. Another thing, all this should be done by the time you talk to your anesthesiologist. Talk to your anesthesiologist. Ask him all the proper questions. If you feel rushed in this process, red flag. Find another doctor. This is not the doctor for you. Regardless, I communicated with my doctor for 3.5 to 4 months prior to me having surgery, and I asked him all the same questions when I got there. And I asked him all the same questions and went over everything day of surgery. If they're not patient enough to answer these questions, then you need to be giving your money to somebody else and finding another doctor that will take the time with you. You are the consumer. You are the one that is going to be put under. You are the one that will be living with these incisions, with these implants. You are the one that's living with the results. So if they don't have the patience to go that extra mile with you, deuces, find another doctor. Regardless where you are going. I've heard so many people talk about or, comment here and there, oh, well, you went internationally. That's a risk. Hello, it's a risk whether you have surgery here. It was a risk when you had weight loss surgery. It's a risk regardless if you have surgery on your toe or surgery all over your body. Every surgery is a risk. Not every doctor is a good doctor, regardless where it goes. Where you go, US, China, internationally, another country, no matter where you go, it is your responsibility to get educated. By the time you get to that doctor, get educated. Another good thing, find out whatever procedure you plan on having, find out what are the different types of procedures that are available for that. For example, Dr. Sue, there's 5 different ways that he does a tummy tuck. And I like that. Why? Because you could be 100 pounds and I used to be 270 pounds. We will not have the same tummy tuck because your girl was carrying skin. Someone that was 100 pounds that wanted to have a tummy tuck is a whole different ball game. So find out, make sure they know you were a weight loss surgery patient. Make sure they know all the details possible. Here's another red flag for you. If you explain to a doctor that you're a previous weight loss surgery patient, number one thing that the minute I told my surgeon that, number one thing out of his mouth was, how's your iron? I was like, oh, it's good and this and that. Okay, he's all, okay, well, I believe you, but I'm not going to take your word because I need to do certain tests in order for me to make sure that you are a good candidate for everything you want to have done. Okay? Iron, people, if you are a previous weight loss surgery patient and your iron is low, do not get discouraged when they tell you they cannot do all these surgeries at the same time. If you are anemic, that is a red flag for a doctor. It is so important. If you know you're going to have cosmetic surgery coming up, start working on your iron. That is big. Big, big, big. One thing I liked about Dr. Sue was that knowing that I was going internationally, any doctor could have just took my money. And the first thing out of his mouth was, this is everything you want to have done. But I'm telling you right now, if your, iron and your blood work doesn't come back A1, guess what? I'm going to have to do the minimal work on you, and I cannot do more than one surgery at once. Okay, so I was shitting in my pants for 2 hours until my results came back. If a doctor tells you I cannot do more than one surgery at a time because of your health, do not get discouraged. Just because you want to have it done, and just because you're paying the money, if they're telling you health-wise it is not okay, do not push the envelope, because at the end of the day, this is your health. Let me see. Make sure you are 100% prepared. Out of everything, out of your consultation, everything the doctor tells you, make sure you go home and Google and reference everything that he's told you, okay? Yes, I went internationally. Because I also had my weight loss surgery internationally as well in Nicaragua. So, because I knew the hospital where I was going, and I knew, the doctor, get to see the doctor's work. Ask to see pictures, ask to talk to his other patients, ask to talk to people that have had surgery with him. Look at what his work is. Just because you've heard, oh yeah, this is a good doctor, and you're talking to someone that, has had surgery with him, ask to see their incisions, ask to see what they look like. Make sure you get educated. Just like weight loss surgery, I see so many people that want to have weight loss surgery because their friend had it and they got a good result. It's not that easy, okay? Having weight loss surgery, there comes so much with it than just having this little surgery that's going to be a tool that's going to help you lose the weight. Guess what? No, there's all kinds of shit that comes with having weight loss surgery. Be an informed, I don't even want to say customer, but be an informed patient that does their research. I see so many people that want to start juicing, that want to get weight loss surgery, that want to have cosmetic surgery, that, want to get Botox, that want to do all this and that, but they base their decision because the next person said that, it was the greatest thing to do. Get informed. If you're going to start juicing, get informed. There's different ways on how to juice, to lose weight, to maintain. Make sure it's healthy for you. If you're going to have weight loss surgery, get informed the type of surgery you're having. Talk to other people that are living it. It's not a matter of just having a type of surgery. At the end of the day, with all this said and done, if you don't get informed, if you don't cross-reference, if you don't feel comfortable, if you don't ask the proper questions, at the end of the day, it is not the doctor's fault if he did a bad job on you. It is your fault because you allowed this doctor, to do these procedures on you without you being 100% comfortable or being informed or asking the correct questions. I hear so many people talk about risk. Everything is a risk. I went internationally, not only for my cosmetic surgery, but I also went internationally for my weight loss surgery as well. I had really good results. Mind you, I had my weight loss surgery, and all the research and everything I learned about my weight loss was on YouTube. Because I did go internationally, I didn't have option to take classes. I didn't meet with a psychiatrist. I didn't have any preparation other than the research I did. I Googled, I YouTube the hell out of YouTube for like 6 months prior to my surgery. Why? Because by the time I got into that bed, there was nothing the doctor could tell me that I already didn't know, that I already wasn't mentally prepared for. You are the only one responsible to prepare yourself for these surgeries. Again, I cannot stress enough. Ask the questions, talk to people that have gone to that doctor, get to see his work, put yourself out there and really get informed. If you meet one doctor and you're not happy, I don't care if you go through 10 doctors, but if you do not feel 100% comfortable and you still have doubts the day you are going into surgery, walk away and do not have the surgery, because you will regret it later and you will be put in situations that you could have avoided. So I hope this video was helpful to you guys. I will put some pictures of me, of my surgery before and after, just so you guys can kind of get a feel of what I went through. But I hope it was helpful to you guys. Thanks.